Final video for chapter 26, and this is on abnormalities of acid-base balance. So all imbalances are going to be classified as either respiratory or metabolic. Respiratory acidosis or alkalosis is going to be caused by a failure of the respiratory system to perform a pH balancing role. The single most important indicator is going to be blood PCO2. Metabolic acidosis or alkalosis, these are going to be all abnormalities other than those caused by PCO2 levels in the blood, and it's going to be indicated by abnormal bicarbonate levels. The most important indicator of inadequacy of respiratory function is PCO2 level, and it's normally going to be somewhere between 35 to 45 mmHg. PCO2 above 45 is respiratory acidosis, and a common cause of acid-base imbalances, and it's going to be due to a decrease in ventilation or gas exchange. So examples of this could be someone who has emphysema, pneumonia, cystic fibrosis. CO2 accumulates in the blood and pH drops. PCO2 below 35 mmHg is respiratory alkalosis, and this is a common result of hyperventilation, which could be due to stress or pain, and CO2 is eliminated faster than produced. And this is a table that looks at respiratory acidosis and alkalosis, some of the causes. We move on to metabolic acidosis. Low blood pH and bicarbonate. Causes include ingestion of too much alcohol, excessive loss of bicarbonate, like, for example, for somebody who has had persistent diarrhea. Accumulation of lactic acid, which could happen because of exercise or shock. Ketosis and diabetic crisis, starvation, and kidney failure can all lead to metabolic acidosis. Metabolic alkalosis is indicated by rising blood pH and bicarbonate. It is less common than metabolic acidosis. Causes include vomiting of acid contents of stomach or intake of excess base, like if somebody takes too many antacids. So the effects of acidosis and alkalosis. Remember, blood pH, it has to be maintained within a pretty narrow range. And if it gets below 6.8, it causes depression of the central nervous system, which can lead to coma and death. pH above 7.8 causes overexcitation of the nervous system, which can lead to muscle tetany, extreme nervousness, convulsions, and death, often from respiratory arrest. If acid-base imbalance is due to malfunction of one physiological buffer system, the other one tries to compensate. In other words, the respiratory system attempts to correct metabolic acid-base imbalances, and the kidneys try to correct respiratory acid-base imbalances. First, we're going to talk about respiratory compensation. So lungs try to compensate for metabolic pH problems just by changing the respiratory rate and depth. In metabolic acidosis, the respiratory system compensates by increasing the rate and depth of breathing. High hydrogen ion levels stimulate the respiratory centers. Metabolic acidosis with respiratory compensation is indicated by blood pH below 7.35, low bicarbonate level, and PCO2 levels below normal as the lungs blow off more CO2. In metabolic alkalosis, the respiratory system tries to compensate by decreased breathing. Slow, shallow breathing allows CO2 or carbon dioxide to accumulate in the blood, which is going to lower pH. Metabolic alkalosis with respiratory compensation is indicated by high pH, which is due to elevated bicarbonate levels, and a PCO2 above 45 mmHg as the lungs try to build up hydrogen ion levels. We move into renal compensation. So kidneys attempt to compensate for pH problems that are caused by the lungs by adjusting bicarbonate levels. In respiratory acidosis, the kidneys reabsorb more bicarbonate, create new bicarbonate, and secrete more hydrogen ions. Hypoventilation can cause elevated PCO2. Respiratory acidosis with renal compensation is indicated by low pH, high PCO2, and bicarbonate levels. And the high bicarbonate levels indicates the compensation by the kidneys. In respiratory alkalosis, the kidneys excrete more bicarbonate. Respiratory alkalosis with renal compensation is indicated by high pH, low PCO2, and decreasing bicarbonate levels. The respiratory system cannot compensate for respiratory acidosis or alkalosis, and the renal system cannot compensate for acid-base balances that are caused by renal problems. This is a table looking at metabolic acidosis and alkalosis, possible causes. And this, again, this should have said question, not questions, but this is the question. And that is all I have for you for this chapter. Have a great day.